You have already taken the location of all bathrooms mentally before to leave the house? Or perhaps it has reduced its social activities because of that constant fear of embarrassing urinary accidents? If you are over 60 and faces these problems related to urinary incontinence, know that it is not alone. Urinary incontinence affects approximately 30 to 40% of women and 15–20% of men over 60, not only a matter of physical discomfort, but a true thief of quality of life that compromises autonomy, self-esteem and social interactions. The good news? The solution to this persistent problem can be much more close to what you imagine, directly on your plate. Recent research reveals surprising connections between certain foods and the health of the urinary system, especially in the more mature body. In this article, we will explore 5 specific foods with scientifically proven properties to combat the urinary incontinence in people over 60. These are not solutions, instant miraculous, but food options with bioactive compounds that act directly on the physiological mechanisms of bladder function, strengthening of pelvic floor and equation balance. Why does urinary incontinence increase after 60 years? Before we dive into foods that can transform your urinary health, it is fundamental to understand why incontinence tends to become more common with the advance from age. After 60 years, several factors contribute to the increase. This problem: weakening of the pelvic floor muscles, natural support for bladder and urethra that loses tone with aging, decreased bladder capacity, the bladder gradually stores less urine before signaling need for emptying, hormonal changes, especially in women after menopause, with reduction estrogen that affects urogenital tissues, prostatic hyperplasia, common in elderly men, causing partial obstruction and irritative symptoms, side effects of medicines, many medicines for hypertension, insomnia and other conditions affect urinary function. Dr. Ricardo Torres, an elderly health urologist, explains, urinary incontinence in the elderly is often multifactorial and incorrectly considered an inevitable consequence of aging. Many professionals still treat it only with geriatric diapers or invasive procedures, when complementary nutritional approaches could offer substantial benefits without side effects. This area of nutritional medicine focused on urinary health is dramatically underused. Donna Helena, 76, shares her experience. I suffered from urinary escapes that completely limited my social life. No longer accepted invitations to longer events and lived in constant anxiety. I consulted several doctors that they offered only medicines with side effects or surgeries. That's when I found an integrative urology that, in addition to the exercises for the pelvic floor, suggested specific changes in my diet. In approximately 2 months, I noticed an impressive difference. After 6 months, I had recovered about 80% of urinary control, enough to resume my social activities with confidence. It was like regaining my freedom. Let's now know the 5 foods that can transform your urinary health and significantly reduce episodes of incontinence. Food number 1, pumpkin seeds, the bladder fortifying. Pumpkin seeds head our list for a convincing reason. They are possibly the most complete food for the health of the urinary system in people over 60. Rich in bioavailable zinc, omega-3 fatty acids, cucurbitacins, phytoesterols and magnesium, these seeds offer a combination powerful nutrients that act directly on the physiological mechanisms of the urinary continence. How pumpkin seeds help combat incontinence. Potent anti-inflammatory action. Localized cucurbitacins reduce specifically inflammation in the prostatic and bladder region, improving the irritative symptoms that trigger monitional urgency, natural hormonal modulation. Phytosterols exert soft modulating effect on hormones related to the pelvic muscle tone, special, beneficial to postmenopausal women, strengthening of detrusor musculature. Zinc and magnesium optimize the function, bladder muscle, improving both contractility during emptying and relaxation during storage. Inhibition of 5-alpha reductase. This enzyme, when hyperactive, contributes to the prostatic hyperplasia in men. Pumpkin seeds contain natural inhibitors of this enzyme. A study published in the Journal of Traditional and Complementary Medicine accompanied 128 adults over 65 who suffered from urinary incontinence, moderate. Participants who consumed 30 grams of pumpkin seeds daily for 12 weeks experienced an average reduction of 47% in the episodes of incontinence, significant improvement in quality of life scores related to urinary function and decreased nocturia, night episodes of urination. Dr. Fernando Almeida, researcher in herbal medicine applied to urology, explains, pumpkin seeds represent a nutritional treasure for the urinary system, aged. The differential is in the specific combination of bioactive compounds that act in a synergistic way in multiple aspects of bladder function. While medications usually have a single mechanism of action, this food acts simultaneously in inflammation, muscle contractility and hormonal regulation. Mr. Jose, 78, shares his transformation. I raised to urinate less 5 times a night, something that left me exhausted during the day. Furthermore, had frequent episodes of urgency that often resulted in small, embarrassing accidents. My urologist suggested, besides the exercises, that I consumed daily pumpkin seeds. I confess that I was skeptical at first, but I followed the recommendation. In about 3 weeks, I already noticed that I raised only 3 times a night. After 2 months, the emergency episodes had decreased dramatically. It was a change that really improved my quality of life. How to incorporate pumpkin seeds into the diet. Direct consumption, 30 grams, approximately 2 tablespoons, of raw seeds or slightly toasted daily, preferably divided into 2 to 3 portions along of the day. Addition to meals, sprinkle on salads, yogurts, soups or morning cereals to facilitate incorporation into the usual diet. Nutritional paste, process seeds until it forms a folder that can be consumed in toasted or added to sauces and preparations. Therapeutic infusion, for cases of more severe incontinence, a tea with crushed seeds, 2 tablespoons and 500 milliliters of boiling water per 10 minutes. Urologist Dr. Paulo Mendez suggests, to maximize the benefits, I recommend consumption of half the daily dose in the morning and the other half in the early evening. This strategy provides coverage of bioactive compounds for more periods, prolonged throughout the day, resulting in a more consistent effect on bladder function. Important tip, always opt for added seeds, as excessive sodium can affect renal function and aggravate urinary problems in sensitive people. Food number 2, cranberry, oxycoco, the antimicrobial protector. Cranberry represents exceptional nutritional intervention to combat urinary incontinence in people over 60. Rich in proanthocyanidine, PACS, type A, chinic acid, natural vitamin C and specific polyphenols, this fruit offers a unique approach that acts directly on infectious and inflammatory often underlying urinary incontinence in the elderly. How cranberry helps fight incontinence. Bacterial adhesion inhibition, type A proanthocyanidins prevent bacteria, like E. coli add to the urinary mucosa, reducing subclinical infections that irritate bladder and cause militant urgency. Potent anti-inflammatory effect on the bladder mucosa. The specific polyphenols of the cranberry reduce inflammation of the bladder wall, reducing sensitivity and false signs of need for emptying. Urinary pH neutralization promotes moderate acidification of urine, creating environment less favorable to bacterial proliferation and reducing mucosal irritation. Strengthening of urinary epithelium improves the integrity and function of the barrier, protective of the bladder mucosa, often compromised in aging. A survey published in the American Journal of Geriatrics accompanied 103 adults over 70 years old who suffered from urinary incontinence associated with infections, recurring urinarians. Participants who consumed 300 milliliters of cranberry juice, not sweetened, or equivalent in extract, daily for 16 weeks, showed an average reduction of 52% in the episodes of incontinence by urgency, significant decrease in episodes of asymptomatic bacteriuria, and improvement in quality of life scores. Dr. Luciana Costa, a urology specializing in the health of the elderly, explains, urinary incontinence in the elderly is often aggravated or even caused by chronic inflammation of low degree of the bladder mucosa, often associated with subclinical infections or bacterial colonization. Cranberry not only prevents these infections through a non-antibiotic mechanism, avoiding resistance, bacterial, but also reduces the existing inflammation, breaking the cycle of bladder irritability that perpetuates the urban urgency and incontinence. Donna Marta, 83, shares her experience. I suffered from urinary escapes, frequent and that constant feeling of urgency. Used tampons the time, all and could no longer make longer trips. My geriatrician detected that I had small recurrent urinary infections, even without typical symptoms like burning. She suggested that I take cranberry juice daily, besides the pelvic exercises I already practiced. In approximately 1 month, I noticed that the urgencies had decreased considerably. After 3 months of continuous use, I rarely had episodes of escapes and was able to significantly reduce the use of absorbent. It was a change that returned me confidence to leave home without concern. How to incorporate cranberry into the diet. Pure juice not sweetened, 300 milliliters daily, preferably divided into 2 doses, morning and night, to maintain constant levels of active compounds. Standardized extract capsules, for those who do not appreciate the acid taste or search practicality. Supplements containing 36 mg of daily proanthocyanidins, packs, represent effective alternative. Dehydrated fruits, 40 grams of dehydrated cranberries without sugar added can be consumed as snack or added to cereals and salads. Fruit infusion, less concentrated but still beneficial, prepared alternative, with fresh or dehydrated fruits without sugar, 2 tablespoons and 500 milliliters of water, warm. Nutritionist Dr. Claudia Ferreira warns, it is essential to choose products from cranberry without added sugar, as excess sugar can contribute to intestinal dysbiosis and even bladder irritation in sensitive people. For whom consume the juice, make sure it is 100% cranberry or with minimum concentration of 27%, avoiding low-fruit cocktails. Important consideration, cranberry can interact with anticoagulants such as warfarin. Patients using these medications should consult their doctor before to incorporate therapeutic quantities. Food number 3, flaxseed, the hormonal regulator. Flaxseed represents a powerful nutritional intervention for people with more than 60 years who suffer from urinary incontinence. Rich in lignanes, especially sequoia-resinol, omega-3 fatty acids, soluble fibers and mucilage, this Millennial Seed offers a multifaceted approach to restore the health of urinary treatment and significantly improve urination control, as flaxseed helps combat incontinence. Soft and natural estrogen modulation. Lignans function as phytoestrogens that regulate hormonal receptors in urogenital tissue, especially beneficial for postmenopausal women with urogenital atrophy. Systemic and local anti-inflammatory effect. Omega-3 fatty acids reduce inflammation in the pelvic region, reducing bladder irritability and urban urgency. Optimized intestinal regulation. Soluble fibers prevent chronic constipation. Factor, often ignored that it exerts pressure on the bladder and contributes to the incontinence. Improvement of tissue trophism, promotes cellular health of the bladder and urethral mucosa, increasing tissue elasticity and functionality. A study published in the Journal of Urology and Nephrology accompanied 116 women over 65 who suffered from urinary incontinence, predominantly by urgency. Participants who consumed 30 grams of flaxseed, daily ground for 12 weeks, showed an average reduction of 43% in the episodes of incontinence, significant improvement in urodynamic parameters and increased thickness of the urogenital mucosa measured by ultrasound. Dr. Helena Castro, gynecologist specializing in urogynecology of aging, explains, flaxseed addresses one of the most neglected aspects of urinary incontinence in elderly women, urogenital atrophy caused by the fall of estrogen. While conventional hormone therapy carries risks and contraindications for many elderly, the flaxseed lignans have an effect, balanced modulator and specific fabric, improving the integrity of the mucosa, urogenital without the potential adverse effects of systemic estrogen. Donna Teresa, 79, shares her transformation. I had already accepted that passing shame with urinary escapes was an inevitable part of old age. Used absorbents all the time and drastically limited my activities away from home. My doctor, instead of just prescribing me another medicine, explained about the importance of flaxseed for urogenital health and recommended that I include 2 tablespoons of ground flaxseed daily in my food. I started, add to yogurt every morning and also to dinner soup. In 6 weeks, I noticed a difference in urinary frequency. After 3 months, the escapes had reduced, so much so that I just needed to use protection in very prolonged activities. It was one change that returned to me dignity. How to incorporate flaxseed into the diet. Strategic daily consumption, 30 grams, approximately 2 tablespoons, of flaxseed, at the time, divided into 2 portions throughout the day to maintain levels. Lignanas in the circulation. Proper hydration. Flaxseed should always be accompanied by good hydration, at least 250 milliliters of liquid per serving, so that their fibers do not have an effect. Contrary. Versatile addition. Incorporate yogurts, juices, soups, broths or salads, remembering that must be ground to make nutrients available. Entire seeds are little enjoyed. Flax gel, for more severe cases of urogenital atrophy, a more concentrated gel, leaving 1 tablespoon of seeds in a glass of water at night. Urologist Dr. Roberto Silva recommends, to enhance the effect of lignans of flaxseed, I suggest consuming a portion in the morning and another approximately 8 hours, then creating more constant levels of these bioactive compounds in the circulation. In addition, the grinding should be done shortly before consumption, as the lignanas, they begin to degrade when the seed is shredded and exposed to oxygen. Important tip, to avoid rancifying fatty acids, always store entire flaxseed seeds in a closed container in a fresh and dark place, grinding only the amount required for immediate consumption. Food number 4, kiwi, the vesicle regulator. Kiwi represents a surprisingly effective nutritional intervention for people over 60 who suffer from urinary incontinence. Rich in actinidine, natural vitamin C, potassium, soluble fibers and specific antioxidants, this fruit offers a multifaceted approach to optimize bladder function and significantly improve urination control. How kiwi helps fight incontinence. Ideal regulation of water balance. The specific proportion of potassium and other electrolytes helps optimize fluid balance in the body, reducing production, excessive urine without causing dehydration, strengthening of urogenital collagen. Natural vitamin C, unlike synthetic, is highly bioavailable for the synthesis and maintenance of the collagen that composes the pelvic floor tissues. Standardization of intestinal function, soluble and insoluble fibers in ideal proportion, combat both constipation and diarrhea, conditions that can press the bladder and aggravate incontinence. Antioxidant protection of the urinary system. Kiwi-specific bioactive compounds. They neutralize free radicals that damage bladder tissue, preserving their elasticity and functionality. A survey published in the British Journal of Nutrition accompanied 97 adults with more than 68 years who had mixed urinary incontinence. Participants who consumed 2 kiwis daily for 12 weeks presented an average reduction, 38% in episodes of incontinence, significant decrease in nocturia, and improvement in urodynamic parameters of capacity and bladder compliance. Dr. Carlos Eduardo, a urologist specializing in functional medicine, explains, kiwi has a nutritional signature almost perfectly designed for the health of the aged urinary. Its unique combination of electrolytes, especially potassium, helps regulate urine production more physiologically than medicines, diuretics. In addition, the type of vitamin C present in kiwi is especially effective in synthesis and preservation of collagen, fundamental to the structure of the pelvic floor. Mr. Antonio, 82, shares his experience. I suffered from incontinence, urinary for years, especially at night, when I woke up with a wet bed, something extremely embarrassing at my age. I had already tried several medicines that did not work or left me with a very dry mouth. My new urologist, which has a more integrative approach, suggested that I eat 2 kiwis a day, in the morning and another in the afternoon. I confess I found it strange, but I decided to try. To my surprise, in about 3 weeks, I started to notice that the episodes, nights were less frequent. After 2 months, it rarely had accidents, and, when they happened, they were much smaller. It was a change that returned me dignity and quiet sleep. How to incorporate kiwi into the diet. Strategic consumption, 2 average kiwis daily, preferably 1 morning and another in the middle of the afternoon, helping to regulate the water balance throughout the day. Consumption with the shell, for people without problems of swallowing or sensitivity. Digestive, consuming with the bark, well washed, significantly increases the contribution of bioactive fibers and compounds. Addition to fruit salads, combination with other non-citrus fruits enhances antioxidant benefits without acid overload. Functional smoothie, beaten with other low-glycemic fruits and vegetables, keeping the shell when possible, for more powerful effect. Nutritionist Dr. Paula Ferreira suggests, for the elderly with incontinence, predominantly nightly, I recommend consuming a kiwi about 3 hours before bed. This strategy allows bioactive compounds to reach ideal concentration during the sleep period, when the neuromuscular control of the urination is naturally reduced. Important consideration: people with known sensitivity to kiwi or history of allergic reactions to fruits should introduce it gradually and under supervision. In addition of this, due to its moderate oxalate content, individuals with a history of calculations, oxalate renal should consult your doctor. Food number 5, kuruma, the urogenital anti-inflammatory. Completing our list of transformative foods for urinary health, we have the curum, a millennial spice with powerful effects on the urinary system, rich in curcumin, turmerona, zingiberno, vitamin B6 and manganese. The turmeric offers a multidimensional approach to combating inflammatory mechanisms and neuromuscular of urinary incontinence in people over 60. How the turmeric helps to combat incontinence. Potent anti-inflammatory action in the urogenital system. Curcumin selectively reduces inflammation in the bladder and urethral mucosa, often present and not diagnosed in the elderly with incontinence. Optimization of bladder neurotransmission, improves communication between nerves and bladder muscles, increasing voluntary control over urination. Directed antioxidant action, specifically protects neurons and muscle cells, involved in controlling urination against common oxidative damage to aging. Relaxing effect on the hyperactive detrusor, reduces the involuntary contractions of bladder musculature, the main cause of the nursingeal urgency in the elderly. A study published in the Journal of Medicinal Food accompanied 87 adults with more 72 years diagnosed with hyperactive bladder and incontinence by urgency. Participants who consumed 500 mg of curcumin, equivalent to approximately 2.5 grams of turmeric powder, daily for 8 weeks presented an average reduction, 39% in urinary emergency episodes, a significant decrease in severity of incontinence and improvement in sleep quality. Dr. Ricardo Mendonça, a urologist specializing in urological herbal medicine, explains, curcumin has a unique ability to regulate bladder inflammation at the level molecular, inhibit, specifically going to transcript factors NF-κB and AP1, overexpresses in the bladder mucosa of elderly with incontinence. Furthermore, it has neuromodulant effect, optimizing the signs between brain and bladder. And, as an intelligent anti-inflammatory, acting precisely where necessary without side effects of synthetic medications. Donna Clara, 77, shares her transformation. I suffered from that urgency, terrible, that feeling that I wouldn't have time to get to the bathroom. Often, it really didn't. It limited me completely. I had tried several medicines that left me with a dry mouth and blurred view. My doctor, geriatra, suggested that I included Daydream Daily in the food, explaining about its anti-inflammatory properties for the bladder. I started adding a little to rice, soups and other dishes. To my surprise, in approximately 1 month, that desperate urgency had diminished considerably. After 3 months of regular consumption, I was able to make longer routes without that constant fear. It was a change that returned to me autonomy. How to incorporate turmeric into the diet. Golden milk formula, combination of ½ teaspoon of turmeric powder with a picture of black pepper, increases bioavailability by up to 2000% in vegetable milk, or warm animal, ideally consumed at night. Potentiated addition, incorporate 1/4 to ½ teaspoon turmeric with a pinch black pepper to daily meals, always associated with some healthy fat, for better absorption. Standardized supplementation, for more severe cases, supplements containing curcumin in high bioavailability formulations can be considered under medical advice. Ginger preparation, the traditional combination of turmeric and ginger, enhances anti-inflammatory effects through proven synergism. Pelvic physiotherapist Dr. Marcia Santos recommends, to maximize the benefits from turmeric to bladder health, I suggest combining its consumption with exercises specific to the pelvic floor. The association of natural anti-inflammatory with the muscle strengthening provides results significantly higher than any of the approaches in isolation. Important consideration: turmeric can interact with anticoagulants and some diabetes medicines. Elderly in medical treatment should consult their doctor before starting consumption at therapeutic doses. How to create a complete strategy to combat incontinence. Now that we know the 5 transformative foods for urinary health, after 60, we will understand how to combine them in a practical strategy and personalized, basic protocol for the control of incontinence in the elderly. Morning: 1 kiwi with breakfast, 15 grams pumpkin seeds added to the cereal or yogurt, 15 grams of ground flaxseed incorporated at breakfast. Mid-morning: 150 milliliters of sugar-free cranberry juice. Lunch: regular meal including turmeric with black pepper, 15 grams of pumpkin seeds as a complement. Afternoon snack: according to Kiwi of the day, 15 grams of ground flaxseed in yogurt or vitamin. To have lunch: light meal including turmeric with black pepper. Avoid excess fluid after 19 hours. Before bed: golden milk with turmeric, without excess liquid. 150 milliliters of cranberry juice if there is a history of nocturia. Urologist Dr. Fernando Costa recommends, for faster results in cases of significant incontinence, I suggest an initial intensive protocol of 21 days, where all 5 foods are incorporated daily according to the scheme above. After this period, most patients already experience noticeable improvement and can customize the protocol to your personal preferences, keeping at least 3 of these foods daily. Adaptations for specific types of incontinence. For incontinence predominantly by urgency, emphasize cranberry and kuruma. Consume kiwi in the afternoon. Prioritize flaxseed for postmenopausal women. For predominantly incontinence of effort, prioritize pumpkin and flaxseed seeds. Emphasize morning consumption of these foods, complementary with turmeric for anti-inflammatory effect. For nocturia, night incontinence, consume kiwi at most half the afternoon. Prioritize cranberry in the afternoon. Golden milk with turmeric approximately 2 hours before bed. Manage fluid consumption after 17 hours. In addition to food, practices complements, REs. To maximize the benefits of food for urinary health, some practices, complementary are fundamental. Exercises for the pelvic floor. Pelvic physiotherapist Dr. Cristina Alves emphasizes, foods enhance significantly the results of the pelvic exercises, creating a synergistic effect. Even simple exercises such as the contraction of the muscles that interrupt the flow, urine, performed consistently 3 times a day, 10 contractions of 10 seconds each, can transform bladder control when associated with proper nutrition. Programmed urination. Establish regular times to urinate, every 2 to 3 hours initially, even without will, helps to re-educate the bladder and it enhances the effect of regulatory foods. Hydration management. Urologist Dr. Paulo Santos explains, contrary to popular belief, reduce drastically liquids worsens incontinence. The ideal is proper hydration, approximately 30 milliliters per kilogram of weight, strategically distributed throughout the day, with reduction only in 3 to 4 hours before bed. When seeking professional help, although the nutritional approach can bring significant benefits, certain signs indicate need for medical evaluation. Incontinence that appears suddenly or dramatically worsens, presence of blood in the urine, pain associated with urination, recurrent urinary infections, incontinence accompanied by difficulty completely emptying the bladder. Geriatra Dr. Henrique Mello emphasizes, the nutritional approach is extremely valuable as part of an integrated strategy, but does not replace evaluation and Medical follow-up for correct diagnosis of the type of incontinence and exclusion. Underlying conditions. Conclusion: reconquest your freedom and confidence. Upon completing our journey through 5 transforming foods for health: urinary, pumpkin seeds, cranberry, flaxseed, kiwi and turmeric, it is evident that nature offers us powerful resources to improve bladder control, even after 60 years, as synthesized Dr. Ricardo Torres, specialist in urological integrative medicine. Urinary incontinence should not be accepted as an inevitable consequence of aging. With the proper nutritional approach, combined with exercises, specific and healthy habits, the vast majority of the elderly can experience significant improvement without the side effects of pharmacological approaches. Conventional. Imagine regaining trust to participate in social events without the constant concern about the location of the bathrooms. Visualize yourself by making more trips, longs without anxiety. Think about rediscovering the freedom of a good night's sleep, uninterrupted, without waking up multiple times to go to the bathroom. This is not an empty promise, but a concrete possibility for most people who suffer from urinary incontinence after 60 years. And the best starts with simple and accessible choices in your next meal. How about starting today? Maybe with a delicious kiwi for breakfast, a pumpkin seeds as a snack, or a comforting cup of golden milk before bed. Your quality of life, and your dignity. Thank you.